Welcome, everyone, to what is going to be episode 2 of We Get It. My name is Karine Shally-Four. I am the program director with Young Adult Cancer Canada, YAC for short. And we are thrilled to start this new web series where we're going to have a variety of guests talking about a bunch of stuffs that is important to you, our beautiful community of young adults, supporters of young adults, our health professionals, community partners. So, hey, if you're there, welcome. We're happy to have you. This week, I'm super happy. I'm with Debbie Bastien. She's a nurse. She reached out to us a little while ago with so much enthusiasm to be connected to YAG, but mostly to be able to do something with and for the young adult community, which was awesome. And as we were talking together, one of the things that came to mind was, of course, right now in this kind of pandemic era, but also in this fall, starting with flu season and everything, we have had a few conversations in the office around immunocompromised systems, our community members saying, I'm immunocompromised, or am I? I've been out of treatment for a long time, I'm not sure. Jeff even, who is 20 plus years out of his last transplant, was unsure and spoke to his doctor, and it's like, so it depends on a bunch of things. So we had opened up to you some questions that she sent back. So this is going to be what we're going to talk about today with our awesome guest, Debbie. So Debbie, let's first start by just learning a little bit about who you are. Who are you?
Oh, great. Well, thank you for having me here, and welcome to the seminar there today. My name is Debbie. Debbie's fine. I'm a registered nurse. I have been for almost 23 years, in which I can't believe I'm saying it, but yeah, 23 years. I started my career in bone marrow transplantation and malignant hematology. So multiple myeloma, lymphomas, leukemias. But back when I was 20, I started at the Ottawa General. I was here for about 7 years. And then I'm married to a former military member, which brought me out east to the East Coast in Fredericton, a little town outside Fredericton. While I was there, I unfortunately didn't have much contact with cancer patients, cancer survivors. My career led me to teaching. So I taught nursing students there at the University of New Brunswick, which I absolutely loved. From there, I went to teach international students. So students would come to Canada from all over the world. We would train them and bridge their knowledge gaps. And then, of course, they'd be ready to be licensed in Canada. Did some program development with them and some courses. So just a bit of everything, to be honest. When my husband retired and we decided to come back to Ottawa, I was probably on the phone the next morning to my former teammates and colleagues. Some of them were still there, and quickly found my way back to hematology and back to bone marrow transplant. So even though a lot has changed, I'm back where I want to be and where I feel like I need to be. In the bone marrow transplant world here at the Ottawa General, we see a lot of youngsters, over 18 certainly for our population, but it really is a population of individuals I love to work with, I'm really interested in. That's how I found Jack. Ultimately, as I went online to see what I could do to make a difference in this age group, in this period of time, with COVID and all these kind of things, and luckily fell across YAC, researched a little bit, checked out the website, and then of course connected with Karine and Jeff, and is so eager to work with you guys and hopefully answer the questions that you posed today. So thanks.
Thank you. This is great. What a road that you had in your professional life. This is really awesome. We're very grateful that you're connected and that you volunteered to speak of something that I know is important. And a part of me feels like for those who are going to watch, so as we know, we'll have people connecting and watching who are going to be way new to cancer, kind of very early diagnosis with little kind of knowledge of whatever the fuck that is. And then you have like other community members who have been around for a long time. We have supporters. So how about we start? So what do we mean with immunocompromised? What does it mean when you go through cancer and this affects your immune system? Can you speak a little bit about that so people understand?
Absolutely. So my specialty, I guess, is malignant hematology, so blood cancer. But I have, brushed up a little bit since we've been talking about some of the bulk tumors and breast cancers and things like that. So a lot of things can cause an immunocompromised state. And the fancy, is immunocompromised. So, in basic terms, is your immune system has been affected. It is not operating as well as it should as a healthy person. So it could be the disease itself that's causing that reaction. So for example, in leukemias, you have lots of immature white blood cells that are circulating in your bloodstream, and they don't know how to work. They're not mature. So in that regard, while you have some cells there, they're not doing their job because they don't know how. And that's, of course, how you become immunocompromised. And ultimately, with symptoms of cold or bleeding, things like this, come to the emergency room or to your family doctor with these symptoms and say, hey, wait a minute, what's going on? The other side of that is once you start cancer treatment, so whether it be lung or leukemia or lymphoma, any of these kind of cancers, chemotherapy itself, unfortunately, attacks all fast dividing cells. So your immune system and cancer cells, along with your stomach, inside of your stomach, what we call the mucous membranes inside your stomach lining. So when you hear chemotherapy, you hear nausea and diarrhea. It's because that mucous membrane gets very irritated and inflamed. But what happens during chemotherapy is the chemotherapy agent itself attacks all of those different cells, your bone marrow included, which is home to stem cells, which really generate your immune system. And with the impact on that from the chemotherapy, if you're actively receiving treatment and a little bit of time after treatment, you're immunocompromised. So, at its greatest point, your normal white blood cell count, just to give you an idea, is supposed to be between 3.5 and 10.5. So those are our parameters or guidelines at the Ottawa Hospital. They may vary from institution to institution, 4 to 10. But that's a general ballpark. So when you're getting chemotherapy, those blood counts can drop as 0.1, just to kind of give you an idea of, the decrease, the shift, and take, about a couple of weeks, depending on how you're doing post-chemotherapy, to recover. So it really is during that phase of treatment. They say 8 to 10 days post-chemotherapy is when you're most at risk. Mm-hmm. And then your blood counts slowly begin to recover as the further away you get from chemotherapy. So, having had chemotherapy a year ago, 2 years ago, are you immunocompromised? Well, the best person to ask is certainly your family physician, right? And I can't stress that enough. The information you receive today, it does not take the place of any discussions you have with your physician who know your case intimately, right? So yes. I really want to drill that home for everyone listening. I'm kind of trying to cover as much as I can and provide you with the information you need. But that's sort of being immunocompromised in a nutshell in terms of chemotherapy. But as some of you may know, you may be on some kind of immunosuppressant long-term therapy. Mm-hmm. So those are things you want to know about, to ask your doctors about what your risks are as well. But outside of the chemotherapy, if you're getting some kind of treatment, you want to know if that treatment may potentially make you immunocompromised.
Yeah, thank you. That's helpful. Sometimes you think you know things and then it's like, okay, that kind of helps. And it leads really well to one of the first questions we've got, which you touched on. So anyone listening, again, like Debbie said, we're not here to give you the okay on anything. We're here to provide you with information and maybe hopefully kind of a question you will ask then next time you see your doctor or your nurse to say, I need to address that now. I need some clarity on that. So hopefully the conversation today can help you do that. But the first question was, how far out from chemotherapy is one considered immunocompromised? Something that a lot of people have been asking and talking to each other about. I'm sure it varies, but are you able to address some of that?
It certainly varies, and depending on the type of chemotherapy you have, right, any pre-existing conditions you may have, may make you more prone to being immunocompromised for long periods of time. So like I said, the real danger zone when you're actively being treated with chemotherapy is about 8 to 10 days. We call that the nadir, which is a term you may have heard in the hospital or at your appointments. That's kind of the real, 8 to 10 days post. And that's when we anticipate that cells are going to begin to sort of recover and regenerate. So, the big thing that's important is if you're admitted in hospital, the physician won't discharge you home all the time you're severely immunocompromised, okay? It's a risk. Not only are you more at risk for getting an illness, but you'll have a really hard time trying to battle that illness, right? Whether it be COVID, which we're going to talk about later, or just like a basic common cold, things like that. So, I mean, there's no set time frame, but if we're talking about many months after treatment, now I would imagine institutions across Canada follow similar guidelines that we do, and it's depending on how you're feeling, what your body is telling you. So just to kind of give you a glimpse into sort of my world is we check patients' blood work every week. Once they're stable and they're requiring less treatment, less sort of band-aids here and there with medications, we space that out to every 2, every 3, ultimately, then we see them once a year, right, way down the road. So, you want to think of how long ago you had treatment and when you kind of got the okay from your physician, for example, to return to work, right? That means that your physician or your nurse practitioner has checked your blood work and is happy with your white blood cell levels. Things have recovered post-treatment in terms of your immunocompromised state or your immune system. So I think that's sort of the best guideline is, if you're seeing a doctor, every couple of days to get blood work drawn and there's any uncertainty, that's going to be a red flag for you to say, hey, you know what, doc? Do I need to take extra precautions during this time? Flu season and COVID, right? So double whammy, which is what we're going to talk a little bit about later again. I've read through the questions, so I feel like I have it kind of already up in my head.
I like it.
So there'll be lots of connections, certainly, between questions to questions as we talk.
Yes, well, thank you. And one thing which we don't have to get lost in there, but I do wonder, so a lot of our community members, even when they are post-treatment, often that is when a whole lot of stress comes in. And I know there's some research starting to look into the impact stress has on our immune system. Sometimes you go through a super stressful period and you catch a cold at the end of it. And it's like, oh man, everything was done now. And that's when I get sick. It does, because I do think of some of our community members where even if treatment is further away, their immune system is still struggling to catch up because they're going through every stress possible caused by the cancer experience, the finances trouble, the relationships, whatever. So I imagine that plays a role as well. That is harder to pinpoint, I guess. It's not like medical in the same way as chemo and, white blood count.
And we're seeing a lot more, like you had mentioned, the literature, we're seeing a lot more literature really pointing to stress being a potential, throw that in with the other list of potential triggers for cancer, right? Because so many of us ask, well, why me? Or why did I get cancer? And all of these things. So there's genetics, there's, environmental factors, and, stress is really coming up there. And, even with COVID and that, I mean, that in itself is a stress for healthy individuals, right? So that sort of compounds, like you said, all those other stressors that we're seeing. So, I don't think there's any hard evidence out there to say there's a direct link, but certainly as a practitioner, and just in everydayness, seeing patients day in and day out, that I think there really is, a correlation there, or like a connection between, feeling, like you said, just run down and fatigued and overly stressed, and, chemotherapy, like you said, chemotherapy and medications aside, right? So there's so many factors that can weaken your immune system. We talk about lots of our patients, I know for hematology, for example, we get rid of the bone marrow, we get rid of the immune system. So all of these patients are being revaccinated a few months down the line, right? With baby vaccines and right up through. So we're constantly pushing that immune system to give us more and give us more. And here we are in flu season, right? No, what does that mean for me?
Yeah. No, and totally. And I feel like we'll get through the other questions. I feel like there are different plans and ways of actions that people can take to say, how can I protect myself? If, maybe treatment is done, but I feel like my stress level is really high, I'm not sleeping well. So there are all kinds of ways to say, how can I be as holistically healthy as I can in periods where, there are all kinds of things. So let's look at the next question was actually related to what you just mentioned, but someone said, can I get the flu shot?
Yeah. So again, it depends on your immune status. So there's certain elements. So lots of patients, for example, stay on medications longer term, post chemotherapy, maybe to control long-standing nausea. If they're having inflammatory issues, they may be on steroids. So steroids, we know, are a natural immunosuppressant. All right. So we have guidelines for our patients. So for example, if you're on 20 milligrams or less, go ahead, get your flu shot, no problem. Any higher, we don't really recommend it. So again, you really have to stop and take a look at what medications you're on, why you're on them. Is there any potential that they are making you immunocompromised? So if you're not sure, get the okay from your physician or your nurse practitioner. I've used prednisone because lots of patients post-treatment may be using some kind of steroid, and steroids are kind of what we look at least in the hematology world, as something that we have to pay attention to in terms of affecting the immune system on top of everything else, right? So should you get the flu shot? Absolutely. And it's okay to be selfish and tell all of your friends and all of your family, if you want to be around me, I'm more comfortable if you get your flu shot, right? Because the difference with any kind of immunocompromised state, or anybody who's had chemotherapy and drugs and, radiation, all of these different treatments that you guys have all received, some level or not, all or some, have affected your body organs. So if you get sick, you may not recover as quickly as someone who has sort of a clean bill of health. So flu shots, absolutely. We don't, I know in my world, here in Ottawa, we don't necessarily recommend the higher dose one for our patients. The regular flu shot's fine. The only indication would be that you are a few months out post-transplant, so that again your immune system has recovered, okay, that you have an immune system to fight and work with the flu shot. I mean, that's how it works. It helps you make antibodies. So if you're a week or two post chemo, you're not going to be recommended to get the flu shot. Maybe later on if they're still available, but it's still okay that if you're mid treatment or just starting treatment, that you say to people, if you want to visit me or if you want to be around me while I'm getting my treatments, you need to get the flu shot. Right. And I think it's one of the times that you can be selfish and put your foot down. Right. You want to see me? Well, we have a few conditions, right? No cough, no cold, no travel, and of course that flu shot.
Yes. And I feel like this discussion is similar, and we're having it more right now, where it's a responsibility for others. So it's not so much to do it solely to protect ourselves, but to say, if I'm going to be around people who are vulnerable, then it is for them even more than, because, if you're healthy and you're doing well, not to say you won't get the flu, but the chances are different than someone who's going through cancer. Thank you.
Exactly.
Let's look at our next question. So a little longer. Bear with me. I had my stem cell transplant in April 2020, so that's pretty recent. After that, I had a couple of biopsy and PET scan. My blood counts are still on the lower side. My oncologist doesn't have an answer for me, and I'm on 3 Grastofil injections every week. After having injections, still my neutrophils and WBC are low. Is there anything I can do which will help which should help improve, like eating habits, exercise, walk? Is there anything that person could do in regards with that?
So Grastofil is a medication we give when someone's white blood cell count, specifically the neutrophils that they alluded to, are low. So we give that, it's like a stimulant medication for your bone marrow to make white blood cells, okay? And so you can kind of link white blood cells with your immune system, right? They kind of go hand in hand. So the fact that Grastofil is still required to boost your immune system, I would say no. All right. The reason we give Grastofil is to get that white blood cell count within the normal range. So if you're still sort of lingering low, we would, in my program, we would not recommend that you get the flu shot. It may overwhelm your immune system, right? Because, we want to think about, the flu shot is something extra for us when your blood count is that low. So anywhere below 3, like I said, as low as 0.1. Lots of people will need post-chemotherapy. And again, so you may have had a higher dose chemotherapy, so it's taking a little bit longer, or right? So this is where I said, again, just to reiterate, your doctor knows your treatment, right? But if there's any question about that white blood cell count being unstable or potentially too low, right, we would say to hold off on that flu shot. And that would be a perfect example as what we just talked about, right? About having people near you who've had the flu shot. Okay, because if someone has the flu, comes to you who is unable at this time to get the flu shot, you'll likely pick up that flu, and having the flu in an immunocompromised state can be very, very dangerous, and I dare say life-threatening.
Mm-hmm. And she was asking also if there's anything in that specific situation that could be done around eating habits or exercise or walking, or is there anything that could help what the medication is trying to do?
Well, it is difficult because white blood cell count, we have to wait for that bone marrow, right? Those stem cells to kick back in and really be functioning properly, right? And that takes longer if you've got somebody else's stem cells versus your own stem cells, right? Which is a whole different discussion. But certainly, staying healthy, staying fit, eating well, these are all things that, if you do pick up an infection along the way with, when you're immunocompromised, your body will be more fit, hopefully. So I certainly would never discourage, eating well, good hydration, right? Yeah. Washing hands, wearing masks, things like this, which we're doing now with COVID anyway. Mm-hmm. But these are all things for infection. In terms of like mental health, getting out for a walk in this, like, what, it's 16 today, I heard, getting out to walk in the 16 here in Ottawa.
Not here.
Getting out to walk is good, good for the mental health, it's good for the lungs to be out breathing, getting your heart rate up a little bit. So yeah. Will it help directly with the white blood cell count? No, there's not a whole lot than time and perhaps medication that will help with that. Okay. But certainly, in terms of the other aspects, we talked about holism before. Mm-hmm. All of those elements are certainly things that we work on and that we strive for.
Yes. Well, that's good, because I know that for some of the young adults we talk to, it can be depressing when you feel fragile, so you can't necessarily interact with little interactions we can have right now. So when mm-hmm. you can't even do it, all of this can affect, of course, not just the body, who's trying to kind of get back to a more solid immune system, but then our mind and our kind of psyche who's struggling with the isolation and with not being able to do anything and see people. And so, yeah, so I guess, yes, to good eating habit, exercise, some walking, never can't hurt. Mm-hmm. The other question, which you touched on a little earlier, does the amount of chemo you do determine the length of time you are immunocompromised for?
It's usually the type of chemotherapy and the dosing of chemotherapy. So, for example, some chemotherapies may be sort of to clear out any excess. So you start with a higher dose, which gets rid of disease, right? Or hopefully minimizes disease. And then you go into what we call remission. Yeah. And then you may have some consolidation, which is a fancy word for sort of extra chemo, just to make sure things are good in there, right? Like a final sweep through and these kind of things. So it really is not necessarily the length of time that you're on chemo. So if you're on chemotherapy for 2 weeks, within that 2-week period, you'll have your blood cell drop and then continue to drop, right? It's that 8 to 10 day mark post chemo. So if you're getting, let's say, 5 days of chemotherapy, on that 5th day, you're getting a dose of chemotherapy. 8 to 10 days after that chemotherapy, right, you're going to have your low. If you're getting 16 days in a row, let's say, the same thing, right? So you're still going to have that up and down, mm-hmm. But, it's generally the dosing, right? So people will have chemotherapy, and actually someone who had asked about, with their transplant, are they immunocompromised? So when we give chemotherapy before a bone marrow transplant, it's high dose. It takes longer to recover than perhaps a standard dose, So, and again, it depends on it's all about that immune system and how fast your immune system recovers. If you have a leukemia, for example, that it attacks your bone marrow, your counts may stay lower longer than someone, for example, who's received chemotherapy for prostate cancer or lung cancer. Mm-hmm. Now, bulk tumors aren't my specialty, so I sort of say that very loosely. Yeah. But the length of time, it really is the type of chemotherapy and the dose more so than the time frame, if that makes sense.
Yeah, that helps, because the follow-up question was, I did 4 chemotherapy cycles, which ended at the end of May of this year. So how long do I need to be overly cautious? So technically, of course, checking in on all kinds of factors, but technically right now, it could be pretty good.
Absolutely, like May to November, right? That's a good chunk of time. And also, like, one chemotherapy treatment is also, depending on what treatment you're getting, may last a couple of weeks. So that couple of weeks may be one treatment. So it sounds like this person had what we say like 4 rounds of chemotherapy, mm-hmm. right? Like an initial induction and then some consolidation, disease-free, discharge, right? And then we kind of sit and see what happens, right? And there may have been surgery after that, you know, like, I mean, there's so many modalities to treat cancer. But yeah, you know, we would imagine that this length of time, you've had ample time for your immune system to build itself back up. And like I said, sometimes patients are on long-term medication. Like I always use prednisone because it's kind of the go-to, you know, if you read any literature, you see prednisone a lot. Yeah. You know, people who are on low-dose prednisone to keep their immune system kind of at bay, no problem. The higher that those doses of steroids or other medications that you're on that alter the immune system, that's where it becomes risky.
Okay, great. One question, so that is a longer question. So I'm going to read it because I want to, and it is from someone who is older than our community member. So YAC works with people diagnosed with cancer who are 18 to 39, really. This person is 69, but I felt like the content of the question was going to probably relate to anyone who's been in a similar situation. So it's more related to COVID. And the complications around that. I'm 69 years old, survivor, high risk, acute promyelocytic leukemia. Nurse, help me. APL.
Yes,
my chemotherapy consisted of ATRA, edarubicin, arsenic, teraxide. I'm so sorry.
Boy, you're doing a pretty good job.
Mercaptopurin, metotrexate. Anyway, the details of the chemo maybe.
Meds, yeah, right.
I finished maintenance therapy 1 year and a half ago. I was very ill during induction, came close to dying. Blood counts now are good. Since then been hospitalized, but for not sure really about the status of the immune system at this point. And the main concern for that person after going through all of this is the contact with grandchildren in that case, but with children. So if we kind of bring it back to our community members, knowing that some of those treatments could have been received by some of our members, knowing that many of our community members have young families, we have had conversations in the YAC community of people who were pretty sick. So living with stage 4 cancer, having had surgeries and treatment, and having their kid going back to school in September in COVID time, and having to have that discussion at home to say, do we send her or not? Do we send him or not? Because of the risk for the parent going through treatment. Any thoughts you have around that in this COVID?
Absolutely.
year?
Well, that goes through my mind. I have 3 kids, 3 boys, all in school, sent them all back to school. Just simply with the population that I deal with, you know, bone marrow transplants, they're the most probably immunocompromised, you know, for a long period of time. So, you know, we do have those discussions. And I was saying to Karine before we kind of went online was, you know, not that it's a good thing, but with COVID, people are washing hands more. We're all wearing masks. We're social distancing. So in terms of the immunocompromised population, it's kind of helpful. And I don't want to downplay COVID, but it's helpful, right? You know, hand hygiene is enormous in infection prevention. Kids back at school, I mean, there's so many factors. You know, the kids that are older. So my children, for example, my baby is 10. So all of my children are in an age group where they all have to wear masks. So, you know, got the younger kids, right, touching their nose and this kind of stuff. And, you know, so I think we all have to, you know, rest assured that everyone's working really hard to minimize, you know, contraction of COVID, of course, and I'll sort of tag the flu on, right, with that, because precautions are very similar to the flu. A year post chemo, a year and a half post chemotherapy, you know, despite the challenging, the difficult time, like, you know, and certainly, you know, feel for that portion, you know, every time you get chemo, you never know what the outcome is going to be, right? So certainly very scary. And, you know, definitely not wanting to go back there, I think really needs to kind of be acknowledged in this particular question, this story.
Yeah.
But, you know, there's a couple of things that could have come to mind, and because it's been over a year, you know, we talked a lot about, you know, the first few weeks, couple of days during chemo. So, you know, it would be my professional opinion that at this point, the immune system has recovered. We do have lots of patients I know call worried about something, especially during this time. You know, there's no harm in calling the doctor and asking for maybe some blood work for some reassurance, right? Yeah. How is my immune system? I haven't had blood work done in 2 years or a year and a half. What does it look like, right? I'm not sure how other institutions follow up on patients. And that's within your right, you know, especially having been through cancer and been through treatment and knowing what it's like and the risks of being immunocompromised. You know, so I think that rest assured that people that we're in, as we're keeping our bubbles small, hand washing, mask wearing, social distancing. The age of children does play a bit of a role if someone is sort of fresh out of chemotherapy. So if you have children under the age of 2, like our young parents, for example, or friends of, in your bubble, children of friends who are under the age of 2, they haven't been vaccinated yet, right? Against lots of different diseases that are really don't exist anymore because of vaccination. So that's sort of one point. The second point about going to school is, again, and I think it's important, when you're keeping your bubble small in this COVID time and in flu time, you know where those children have been, sort of their activities, who they've been around, and this kind of thing. So it ultimately is your decision. Do you want to be around those? Are there risks? Absolutely. They've been exposed to other children, and we don't necessarily know what other people's, practices are outside of school and so on. So, the fear is there, the fear is real. But being a year and a half, that far out of treatment, and not having, any sort of residual cold-like symptoms or, on a immunosuppressant kind of things, you want to sort of stop and think about, where am I in my health and how I'm feeling? And your best person to answer that is your health practitioner.
Yeah.
And this is, again, where the flu shot comes into play.
Mm-hmm.
You are concerned about getting ill, falling ill. And I think, a key point here, and this may be leading into another question, is what you want to remember with cancer treatment is, even when those blood counts come back to normal and you're considered, no longer immunocompromised and healthy, right? Like you have a healthy white blood cell count, your immune system is working well. You also want to remember, and I don't want to scare anyone, but, when you have chemotherapies, it works your liver really hard. It works your kidneys really hard. Some chemotherapies are really hard on the lungs. You may have had a fungal infection in your lung when you were receiving treatment. You may have had a lung resection. You may have had lung cancer, all of these things. So your internal organs have been affected at some level, right, throughout all of this process. So you want to remember that, even if you get the flu or even if you get COVID, your immune system could probably handle it. But you had previous organ damage or organ involvement. And that's what, worries me the most about, patients, for example. We know COVID, and it's a vascular, disease or infection. So it kind of travels all over your body. But what we see in the literature and on the news every day is the impact it has on the lungs. So, if you've had issues with your lungs throughout chemotherapy, if you've been prone to lung infections with chemotherapy and perhaps post-chemotherapy, if you get COVID, you've already got, I don't want to say a strike against you, but you've already got a compromised lung, right? Or lungs, pulmonary system. I don't want to say it's more so that, but as you look into, am I immunocompromised? I'm 3 years out, I'm 4 years out. No, you're not. But you do want to be mindful that if you do demonstrate any symptoms, even of a common cold, that you get it looked after really, really promptly because of the current condition of your lungs, right? Will they repair themselves? Eventually, but that's the biggest risk that I worry about with our population is you could probably fight off lots of these ailments, but your illness would look very different than mine that have healthy lungs, where of you who've had compromised lungs. So again, not to scare anybody, but we want to look at the really big picture outside of the immunocompromised state, right? Well, I know today's session is on immunocompromised states, but still, we want to sort of all of those bits and pieces of the puzzle, right? If you've had an entire lung removed and you get COVID, you've got one lung to work with, one lung that's going to get you through this illness, right? So this is why, you cannot be too diligent in terms of your hand washing and protection, protecting yourself and also the people around you and who are going to be surrounding you.
Yeah, absolutely. No, it makes sense. And I think we work with young adults. So sadly, it means that the long-term side effects and the possibility of living with long-term side effects is greater. Because they have a lot, hopefully, of living left to do. So to be informed, to talk and to ask questions, to say, where am I more fragile? What organs may have been affected by my chemo? And we talk a lot about that in the community. Usually a lot of our community members are well informed, but even sometimes having that knowledge can help. Because someone was asking, and we were out of time, but we'll take the time to wrap it up properly. Someone was asking, is there any, have you seen anyone, stem cell or cancer patient get COVID? And of course, I'm sure there are. I haven't seen any stats, but in our community, because I think people are extra careful, we have not had many, I'm not saying nobody has got it, but I'm surprised and kind of relieved to see how careful our community members have been with their own health, and how their family and their bubble and their people have been careful with them. So we haven't had a lot of those stories. I don't know, on your end, you're in a hospital, it must be different, but.
No, actually, you know, and again, in our population, we have had a couple and they've survived. You know, again, it's, like you said, our patients, our population, this young population have been through chemo. You're aware of the risks, right? And you know that the hand washing, and you have lots and lots of knowledge that if you stop for a moment and say, okay, you know lots of this stuff, and the repetition sometimes, like I know myself listening to the news sometimes, I get overwhelmed, right? It's all you hear, other than the American election, right? It's all you hear.
It's on my computer right now.
You know, and all we can do is look after ourselves, right? And make sure that we're washing our hands, wearing your mask when you're out and about. You know, we don't want to create that sense of panic. It's a sense of awareness that we want to be mindful of, right? The good thing too about, you know, our young population with YAC, you know, the YAC community is young people are very resilient, and, you know, and come back, and there's, like I said, there's lots of living to do in that. So, you know, be smart about it, right? Listen to your body. Right? If you're getting a sniffle, you're getting a sore throat, get tested, right? It may just be a common cold. I've been tested a couple of times, right? I've got kids in school. I had a sniffle. Guess what? I can't come to work until I get tested, right? So, you know, there's no stigma about getting tested, you know, and we're getting our results more and more quickly these days. You know, if you're feeling unsure of something, you know, I always tell patients, and I tell my staff, and even people that I work, that I teach, you know, go with your gut, right? The good thing is, like I said, you know, keeping our bubbles small, minimizing, you know, big crowds, things like this, wearing your mask, which is mandated now. You know, these are all things that will work in your benefit, you know, being a cancer survivor. But like I said, if something's not quite right, get it checked out. Reach out to someone who can help you and direct you, and answer those questions for you.
That's great. Thank you. That's a great way to wrap things up. We had time to go through all the questions we've received. I'm sure that listening to this, maybe some are going to have more questions, but go to your health professionals and ask the questions. And I feel like your last message, Debbie, is great. Like, you're unsure, go with your guts, you know yourself. So many, like, you're expert of your own body and your own health. So that would be just, you know, something that you can do. One thing that, you know, I always ask, is there one message you want to tell our young adult community? I feel like that's what you said. Like,
I kind of did that naturally. Yeah. But, you know, it's a time to look after you. Yeah. Right. Yeah. And if that means limiting, you know, to one, that's your prerogative, you know. You want to watch out for that mental health side of things. But, you know, and this is where I feel like communities like this, even short discussions like this, can be helpful. Just like that reassurance, that peace of mind. It's stressful for everyone. So certainly we all have our own journey, our own lived experiences. And, you know, it's so important to bring those with you along the way, and do you, you know, I say that at the end of my teaching session. Do you think of you first? And, you know, to keep yourself healthy and happy, physically, mentally, emotionally, spiritually, you know, it's a time to be selfish and protect yourself. And like I said, any uncertainty, any questions, if you need confirmation on your immune status, for example, get a hold of either your hematologist, oncologist, and some of you might be at the point in life where you're being followed now by a nurse practitioner or family physician. You know, don't be shy. It's your prerogative. It's your health, and you're in control.
Awesome. Every Monday, for my message that I send before we say goodbye, every Monday I, on social media, remind myself and anyone who can use it and need to hear it, is to just breathe. So never underestimate the power of taking the time to take a few deep breaths when you're stressed, when you're fearful of something, when you're feeling vulnerable and fragile. This can really help self-regulate your body to kind of just ground yourself a bit and then figure out if you need to do something and what this thing can be. So it's just a reminder that I try and remind myself every day that I love to give to each of you, because this We Get It episode is on Monday. So remember to just breathe, and hopefully that's going to help. Thank you so much, Debbie, for this a little over half an hour, but filled with really great information, very useful information. So I'm very grateful. I'm glad we're connected, and looking forward to doing more with you.
Absolutely, can't wait.
Yeah.
You know where to find me. Nice to meet everyone, and hopefully I'll be seeing you all soon.
Yes,
Bye.
so hopefully, well, we're going to see everyone. So next Monday, we're going to have, actually, you're going to get to know the YAC community. So I'm going to be in the company of 3 amazing young adults in our community, and they're just going to talk about their experience, about their connection to the young adult cancer community, how it's helped them. So you can check it out. And so see you next Monday. Have a great rest of wherever you are on your day. Okay. Bye.
Great. Bye.